Dr. Backman, there are warts out there called gingivitis, periodontal disease, gum disease, whatever those warts are called. Can you shed some light on it? I mean, is that all the same? Is it something different? What do we need to know about it?
Well, the general heading is periodontal disease, and that includes everything from a mild case, which would be gingivitis, which is just a little inflammation or infection on the surface gum, all the way up to periodontitis, which is actually loss of bone, loosening of teeth, and a constant low-grade infection. So that's basically, periodontal disease includes a lot of those disorders.
Okay. So what are there specific stages where there is maybe specific treatments go along with it? Depends on how far it is advanced.
Correct. Generally, gingivitis can be treated by the dentist in a general dentist practice by having your teeth cleaned on a regular basis and by doing some good home care, which includes brushing with a soft toothbrush and dental floss, of course. As the periodontal disease gets a little more severe, there are other modalities that we use to treat them. Some that can be done by a general dentist, but once the periodontal pockets get too deep, then it has to be referred to a periodontist who may have to do surgery on the gums and bone.
I see. Now, we know that gum disease leads to tooth loss, obviously. It leads to apparently bone loss. So now, I have heard that when one has a gum disease, obviously that's an infection. It's kind of like that yellow, reddish, ugly buzz you get when you cut yourself and it gets infected in your finger.
Yes.
Is that right?
Correct. Almost exactly.
Yeah. So, and I have heard that, for instance, there is a study in Japan from a Japanese university which says, for instance, if a person has AIDS, which not many people do, thanks God, but like if actually, let me revise that. If a person has the HIV virus, due to the fact that the gum disease lowers the immune system, that patient is much more easily to get now the full-blown AIDS.
Correct.
And if that could happen, if that is true, wouldn't that mean that your next flu season, if you have gum disease, you probably have to fight much harder to overcome it? What's the deal with that?
Well, and I'm glad you mentioned that Japanese study. They have other studies that have been going on in Japan, Europe, and we're doing a lot of research in the United States too. Not only does that periodontal infection lower your general resistance to other infections, but there has been a link now between periodontal disease and cardiovascular disease. Right now, it hasn't been proven definitively, but the same enzymes that are produced by the bacteria in your mouth are the same enzymes that cause plaque to form on your vessels of the heart. So there's a connection between your periodontal health and the rest of your health, and possibly your cardiac health.
Well, I mean, I don't want to have that yellow reddish pus traveling around my blood, because an infection is an infection. I mean, when people get their toe infected, they go to a podiatrist and fix it, or whatever, and you don't want to have a nail sticking in. You go and get your tetanus shot, and you do something about it. So it makes no sense to me that we shouldn't go when we have an infection in the mouth, which is the gateway to the blood vessel, right?
Yes, it is.
That we shouldn't fix that, and because it will go into the blood, which goes to the kidney, which goes to the liver, which goes everywhere, right?
Correct. Yes. These infections are usually ignored by most people and most practitioners, but they're very critical to the general health of the patient.
So maybe I should just end this interview and go to a dentist and get my infection cleaned out with a good cleaning.
Get your teeth cleaned. That's right.
All right.
Well, the sad story is, Mr. Flash, is that only 60% of the people in the United States see a dentist regularly. Isn't that amazing? Only 60%.
It is amazing, and what it is amazing. Realizing of like talking to you and to other dentists how it impacts our overall health. It's not just about having a pretty smile. It's not just about not smelling from your mouth. I mean, you know, neck pain, shoulder pain, and infections and immune system down. I mean, gee, it looks to me this is something you need to take care of.
Absolutely, absolutely.
And I've heard that dentistry is pretty much the absolute most preventive medical discipline there exists. Nothing can be as precisely prevented, as predictably prevented as dentistry. Is that true?
Well, in general, it is true, especially when you're talking about periodontal disease and dental disease in general. That if there's a program of good home care and regular trips to your dentist, almost all of dental disease is preventable. Can't really say that about many other modalities, but in dentistry it's true. Our problem is getting people to comply, people to go to the dentist regularly and to take care of their teeth at home.
Well, let's hope that video helps to get at least a few more people to comply and stay healthy.
I agree.
Thank you, Doctor. Thank you, Dr. Bachman.
You're welcome. Bye-bye.